everyone, to the third and final session of our Whole Person Care webinar series on weight management and metabolic health. I'm Dr. Jeff Glad. I'm the Chief Medical Officer at Fullscript, and I'm thrilled to close out this transformative series with today's topic, Streamlining Whole Person Care, Clinical Tools for Metabolic Health and Weight Management. Before we dive into this one, I want to recap what we've covered so far. In the first session, we were able to explore how different diets impact the gut microbiome and metabolic health, and how stool testing can support personalized care with Doctors Data Staff Doctor of Clinical Education, Dr. Julia Malkowski. The second session focused on the mechanisms by which the gut microbiome mediates metabolic health and the role of the gut metabolism axis in natural GLP-1 production, as well as the benefits of live Akkermansia-based probiotics with Pendulum's Chief Medical Officer, Dr. Adam Perlman. If you missed the sessions, don't worry. You can catch those recordings anytime. We're going to post those in a couple days when they're all ready at fullscript.com/webinars. In this last session, we're going to explore practical clinical tools to streamline whole person care in your practice, equipping you with actionable strategies to support your patient's metabolic health and weight management goals. Before we begin, a couple housekeeping notes. Please use the chat feature for the Q&A section. So the team is gathering those questions. I'll try to wrap up with 5 to 10 minutes to be able to address those questions, and we'll talk about them as part of the session. Again, the webinar is being recorded also. So same location, fullscript.com/webinars. You'll also be getting that via email for anyone who has registered or is attending the session. We also know the last couple sessions, people noticed that the slides were a little bit small. So there is a files area that you can grab those slides and open them up on your screen if you'd like to see a bigger version of that. And that's where that copy of those slides will be available for you. So thanks for joining this series. We're excited to be hosting it. There'll be many more coming, but let's dive into the talk. So we're going to be covering whole person care protocol templates within the Fullscript platform, specifically to today's topic, metabolic health and weight management. We'll talk about how lifestyle medicine principles provide a holistic approach to metabolic health and sustainable weight management. So we all know whole person care isn't just lab testing. It's not just supplementation. It really is that foundational lifestyle piece that we never want to forget about. And that's all built into the protocol as well. And then how to apply and customize templates within the Fullscript platform. So quick reminder, this is solely for education of the healthcare practitioner. And that's why we're here today. Let's jump in. So I want to talk about the whole person care protocol templates and really step back a little bit and talk about what templates are in general. These are practical tools that are designed to help healthcare practitioners provide evidence-based suggestions around labs, supplements, lifestyle focus areas specific to a concern or a condition that you're seeing in the practice. The majority, all of the Fullscript templates have been created by the Fullscript advisory team, very heavy in evidence-based medicine. I'll show you where that lives within the protocol so that you can now share those with patients or go on your own learning journey. Think about these templates as a starting point, a very flexible framework you can use to create highly personalized care plans for your patients. They are by no means built to be one size fits all. They are a template for you to look at the evidence, what the recommendations are, and then make your best clinical decision in collaboration with your patient for what's best for them. So whether it's supporting metabolic health or addressing weight management, lots of other concerns you're going to see in clinic, we have these templates that align with a whole person care approach, getting you to treat the individual and not just their symptoms. So leveraging these evidence-based tools, you're able to design these plans that not only address the physical health, but also support overall well-being. So I want to take a little bit of a closer look in terms of what that looks like. Start with labs. Again, if you were in the first session with Dr. Malkowski, you're already familiar with this test and how it can support metabolic health and weight management, but quickly summarize some of those takeaways if you weren't able to attend. The comprehensive stool analysis, or CSA, gives detailed insights into gastrointestinal health. It evaluates gut microbes, digestion, inflammation, while screening 80 microorganisms, which include bacteria, parasites, and fungi. When it comes to metabolic health, though, this stool test can help you and your patients determine how the diets are impacting the microbiome. And actually, there's been some recent studies, if you've seen them, on how the microbiome actually impacts the diet and the cravings of that patient. So it not only gives you that understanding, but provides you with actionable data on how to improve their diet, in turn supporting healthier microbiome and positively impacting metabolic health. Now that we've talked about labs, we'll also talk about supplement ingredients in terms of what are the evidence-based ingredients specific to the weight management and metabolic health protocol. What are the things that can positively influence metabolic health and weight management? So Dr. Perlman covered in detail the impact of akkermansia on metabolic health earlier in the previous session. But the brief recap there is akkermansia may increase insulin sensitivity, reduce insulinemia and cholesterol levels, as well as decrease body weight, fat mass, and hip circumference. It also has shown the ability to stimulate GLP-1 secretion and thermogenesis. I want to take a look at a few other additional evidence-based ingredients that you might consider that are going to be in this template that play a role in metabolic health. Berberine has research showing it helps in decreasing body weight, waist circumference, fasting plasma glucose, A1C, triglycerides, as well as LDL levels and C-reactive protein. Conjugated linoleic acid, evidence to reduce body weight, total body fat, and BMI. EGCG, which is known as green tea extract, may help decrease body weight, BMI, waist circumference, LDL, cholesterol levels. Fiber also has an evidence-based role in this protocol as well as glutamine, omega-3 fatty acids, and whey protein. I mean, whey protein is becoming a very hot topic because of the potential muscle loss if a patient is on a GLP-1, but also muscle protection and even muscle growth, regardless of that patient's weight loss journey. So we know that it can decrease body weight, body fat, waist circumference, and there will be a link to the full template in the follow-up email, and I'll walk through what that template looks like, how you can apply that in your practice, but also know the lifestyle recommendations that I mentioned, so important. And again, part of this protocol because it is foundational in whole person care. So following a Mediterranean diet has been shown to improve biomarkers of metabolic health, as well as so many other benefits consistent with the other supplements that we just mentioned in the previous slide. Stress management, lower stress levels linked to reduced risk of developing metabolic syndrome. Mindful techniques, very, very helpful in terms of mitigating stress, helping patients manage stress. So giving them some tools and some guidance on how stress impacts metabolic health, but also what they can do about it becomes really important. Movement, sedentary activity for 4 or more hours daily has been associated with an increased risk of metabolic syndrome that's independent of a patient's physical activity levels. Sleep, social connectedness, again, really key features that it becomes important to have these professionally authored resources attached to your protocol so your patient really understands this whole person care approach that they're getting. So let's review a case study. That's how I want to kind of showcase the utilization of this template within the Fullscript application so that you can easily make these recommendations in just a couple of clicks. So I want to walk you through a case study, dive into the Fullscript application on building the treatment plan using the template, and here we go. So I want you to meet Sylvia. Sylvia is concerned about her recent test results indicating prediabetes, particularly given her grandmother's passing from a diabetes-related complication. She's aware of the need for weight loss. She's previously tried semaglutide for weight management, but stopped due to worsening constipation. Sylvia aspires to start a family in the near future and understands this is going to be challenging due to her PCOS diagnosis, as well as other health concerns and overall metabolic health. So she's coming to you today because she's determined to improve her health before embarking on that journey. So as you have evaluated Sylvia, maybe looked at her labs or ordered some labs, and now you're kind of coming up with the treatment plan. I would suggest you use the template that's been built as part of this whole person care session today. So from the Fullscript homepage, you navigate to plans. You'll see templates right there under plans. And know that with these templates, you can absolutely create your own. You can create them from scratch. You can take Fullscript's template and customize that to your desired, learning and knowledge, or what you've seen work in the practice. But using templates created by our Fullscript medical advisory team is a really great starting point, because then you can edit them and make them your own from there. And so here, when you in the templates page, you can either search for the whole person care protocol, or you can use the filter and choose protocols made by Fullscript. You're going to see right here in the top left the whole person care protocol, which we're talking about today for weight management support, sitting right there. In one click, now you queue up that as part of Sylvia's treatment plan. In the preview mode here, providers can see the tests that have been recommended and the products that are within this protocol. So here we're going to decide to keep this lab test. Sylvia really understands that her digestive health is probably central to some of her concerns. She had the digestive side effects of semaglutide. She's got some IBS type symptomatology as well. And so she really wants to kind of dive in and learn about the microbiome and its impact on her metabolic health journey. Here on the next screen, and this would just be a scroll down, you can now see the curated products. So when it comes to Sylvia, we're going to take a phased approach, right? Rarely do I ever want to put this entire protocol in someone's treatment plan. It's overwhelming, it's unlikely to fit their budget, and I really want to increase her adherence and really get some small wins as she starts this health journey. So I'm going to remove the probiotic, the glutamine, the berberine, because we're going to focus on the microbiome test as our next steps for what we want to do about her digestive health. I'm taking fiber out of Sylvia's plan. She mentioned that she's tried fiber in the past and it really flares up her IBS. We're going to take that out. And based on our discussion, Sylvia, kind of prioritizing where she wants to focus, where she wants to start. We've also discussed her budget, what's reasonable for her to get started. So we're going to prioritize whey protein, omega-3 fatty acids, EGCG, and CLA. While we're talking about this treatment plan, Sylvia mentioned that she really has a hard time swallowing fish oil capsules, and she would prefer a liquid. So I'll go back into I'll go right into catalog search. I'll search for fish oil. I'll use the filter, which looks at forms of the supplement, and choose a liquid. And now we're going to use the compare feature to find one that matches the dose that I think she should take at a cost that's reasonable to her, because the compare feature is able to price compare based on what that patient's cost is per month. So now we've queued up this treatment plan with a microbiome test, as well as some of the evidence-based supplementation. But again, I want to focus, I guess I should talk about first, the evidence piece here is really also critical, both for your knowledge and understanding, your comfort in making a treatment plan, but also the patient's comfort in this evidence-based plan. We're seeing an increase in patients desiring clinically meaningful supplementation. And so this really kind of makes that connection for them. So in this evidence tab, providers are going to see all of the evidence for each test, the ingredients, as well as the lifestyle recommendations. So you're going to see that support with links to the reference articles to be able to see how this protocol was curated so that we can now focus on an evidence-based treatment plan. Now I want to talk about the lifestyle piece. So you can see here we have pre-populated the lifestyle recommendations that are evidence-based. And so now patients are able to really see the value of this, how it connects to their metabolic health. But what I really want to show you is what actually is happening inside of this template. These resources are queued up within the treatment plan. So we want Sylvia to focus on a diet, and we're going to lean her toward a Mediterranean diet. We're going to increase her movement and understand the importance of that, and that big focus on stress. So these are the resources that are actually attached to the protocol that are going to be delivered to Sylvia in this very elegant PDF format Again, these are professionally authored, but also written so that patients can really grasp the concept here and help make some changes in their lifestyle. So once we've tailored the template to Sylvia's needs, we're simply sending the treatment plan, and now she has access to this plan either via the Fullscript mobile app or on the web. Wherever she feels comfortable reviewing that plan and transacting that plan, she's going to have access to that. So that is it is as easy as that. Again, go into those protocols, really look at what we've built there, and curate them to what you think is most important. And you can go to fullscript.com/protocols. You can view the breadth of coverage that we have for conditions. And again, you can switch out products, you can add labs or subtract labs, make sure those resources are there to support that lifestyle recommendation around whole person care. And again, if you're looking for more info, we'd love to hear from you. We've got a support team, we've got the medical team. If there's protocols you'd like to see or other things as part of the platform that you really need in your practice, we would love to connect with you. All right, so we've got some time for questions here. All right, allergic to whey protein, what is a good alternative? That's a really good question. And again, whether they have an allergy to whey protein or for any number of reasons they are following a vegan diet and whey just doesn't fit. Typically, I'm looking for a plant-based protein of which there are many within the Fullscript platform. So I'm usually leaning toward a pea protein most often. That seems to be the one that's best tolerated and supports that patient's sort of protein desires and supplementation needs. Question on the filters, because it is really important. Patients, are not going to take a supplement if it's in a form that they can't tolerate. And so when you hit the search, there's a little filter. It's like a little funnel next to the search bar. And on the left side pane there, you will see all of the different filters that allow you to find if you're looking for a specific brand. If you're looking for a very specific ingredient, you can put in the ingredient and the dosage. Certainly, there is forms there as well. So if you need a chewable, you need a liquid, you need a powder, or some patients would prefer, I just want to take capsules. So you can search in that filter feature for all of the different forms. You can also see third-party certifications there. So making sure something is vegan friendly, or making sure one of the omega-3 societies has third-party certified the fish oil. Those are all really great features. And then the compare feature is going to be a button there. As you put an ingredient into a treatment plan, you're able to compare similar ingredients and really have the Fullscript AI power which one of these ingredients has the highest repurchase rate, which is really by definition what are patients most adherent to. And I find that is the most popular feature for me, because that tells me patients are taking this, they're tolerating it. Again, whether that's the form or whether that's something around taste or tolerability. But there's also a cost there, so you'll see cost per month. But that compare table is going to lay out what are other ingredients that are in each of those products. If you need to find something that's tolerable from their allergy perspective, or you may see additional ingredients that, hey, I really like this one because it also has B vitamins in it, and this will save them a separate bottle. Is there a number limit to our favorites? There is not any limit there. So you can queue up as many favorites as you want. You can put those into, groupings. So I have, a SIBO favorites. I have a metabolic health favorites. I have a vitamin and mineral favorites. And that gives me really easy access to go right to the supplements that I feel most strongly about, using in my patients. Next question, are the protocols available on the Canadian Fullscript site? They absolutely are. So same templates, they are there, same evidence. What you'll see different though is the products, right? The catalog in Canada is different than the catalog in the United States. We have accommodated for that. So you're only going to see products that are available to Canadian practitioners within those protocols on the Fullscript platform. How long do you use the protocols? Do you recommend retesting after 3 to 6 months, or just go by patient symptoms? Yeah, that's a great question. And if you had a chance to listen to Dr. Perlman's section, he had a question about how long do you put them on an Akkermansia supplement? And it really is a very individualized decision. Typically, I will start a protocol for 3 months because, again, I'm using part of the protocol. I'm not going to use the entire list. I'm going to take the priority focus areas based on that patient. Maybe it's based on labs, maybe it's based on preference. And we're going to start somewhere, and then we're going to decide which biomarkers or which testing is really important to look at in 3 months. And from there, we're going to make decisions. If everything's going well and they're tolerating the protocol, budget-wise, it fits what their needs are, we're going to stay the course and continue to see that success. If we're in need of additional help, I'm going back into that protocol and saying, okay, I know these are all the evidence-based ingredients. What are the next couple things that I should be considering to bring back in? So awesome questions. Those were really, really good. All right, so we are going to wrap here. And this was really, really, this session was incredible. Not this session, this whole experience was awesome. I really hope if you didn't see the doctor's data presentation on the microbiome or Dr. Perlman's talk, really encourage you to go back into that because it really does drive right into the use of the template within Fullscript and really bring that, kind of a whole person care perspective to your practice. So want to thank everybody for attending, as well as engaging. Love the questions. Hope you found valuable insights in how, the gut microbiome, probiotic supplementation, and then just being able to action that on the Fullscript platform can really power your practice. So appreciate everybody's time and attention. Again, look for the fullscript.com/webinars for all 3 sessions today, and look forward to hosting the next one here soon. Thanks.